Hello, welcome to Carter Dermatology, where we strive for excellence and healthy skin. I am Dr. Wesley Carter, and today I want to talk to you a little bit about actinic keratoses, which are sometimes referred to as sunspots or precancerous lesions. So actinic keratoses are rough, scaly bumps or patches on the skin that are caused by intense brief or long-term sun exposure. These spots are most commonly located on sun-exposed areas such as the face, scalp, ears, forearms, and hands. AK is developed due to a lifetime of exposure to the sun's harmful ultraviolet radiation in the invisible light spectrum. Both UVA and UVB radiation damages the DNA programming in the skin, causing skin cells to begin to grow abnormally. The key takeaway here is to understand that AKs are not only due to recent sun exposure that you may have received over the last few years, but rather due to an accumulation of sun damage that started way back in childhood. Daily use of broad-spectrum sunscreen with an SPF of 30 or higher, wearing protective clothing such as hats, long-sleeve shirts, and sunglasses, as well as seeking shade during peak sunlight hours are essential in prevention of actinic keratoses. Additional recommendations include regular skin checks and avoiding tanning beds to further reduce the risk of developing these precancerous lesions. So, why do we treat actinic keratoses anyway? Well, they're considered precancerous, and although most will remain stable or possibly regress, some can progress into squamous cell carcinoma, which is a type of skin cancer. And because we cannot predict which ones will transform, treatment is strongly recommended at this stage. We have many ways to treat actinic keratoses. For example, we have cryotherapy, which utilizes liquid nitrogen, which is more of a targeted approach for isolated lesions. And then we have field treatments, which are generally utilized when there is a larger area of damage. For field treatments, we use topical creams such as imiquimod or 5-fluorouracil, as well as another strategy called photodynamic therapy or PDT, and then chemical peels, which can be used to treat actinic keratoses, although they are not considered first-line treatment. So when will we choose a particular treatment versus another? To explain this, I would like to borrow an analogy from Dr. Lloyd Cleaver, a mentor of mine. And so when you only have one or two weeds in your garden, then you would maybe go out into the garden and pull those weeds by hand. This strategy would be analogous to cryotherapy, where we freeze discrete lesions with liquid nitrogen. It's quick, effective, and best for treating a small number of isolated spots. With cryotherapy, patients often feel a brief burning or stinging sensation, and the treated area may blister or peel before healing. So cryotherapy is most appropriate when there are just a few scattered lesions. Now, when you have a lot of weeds in your garden, for example, you would go out and maybe get the Roundup to get these areas under control. This is analogous to a field treatment when the sun damage is extensive and we want to treat a broader section of the body, such as the face, the top of the head, or the forearms, etc. So field treatments include either topical creams or photodynamic therapy, which these modalities are more appropriate when there are numerous actinic keratoses or when the surrounding skin has extensive sun damage. Topical treatments would include creams such as imiquimod or 5-fluorouracil. They are generally used when patients have many actinic keratoses spread across a sun-damaged area such as the forehead, cheeks, and scalp. These medications work by either stimulating the immune system or directly destroying abnormal cells. They require several weeks of use and can cause redness, crusting, or irritation, but they treat both visible and preclinical microscopic precancerous lesions and are effective in the treatment of actinic keratoses. Photodynamic therapy, or PDT, is another type of field treatment, and this combines a light-sensitive medication applied to the skin with a special light source that is then applied to destroy or target abnormal cells. PDT is often chosen for patients who prefer a shorter treatment course with predictable outcomes and downtime. And Carter Dermatology offers this in-office treatment modality. So what happens if we do nothing? Well, Without treatment, actinic keratoses may persist, they can grow, or progress into invasive squamous cell carcinoma. That risk overall is relatively small for any single lesion, being about 10% per year per lesion of that lesion advancing to a skin cancer. But when multiplied across many lesions and over years of sun damage, the risk becomes significant, and early treatment not only lowers your cancer risk, but also improves the overall health and appearance of your skin. So to sum it up, actinic keratoses are early warning signs of sun damage that can lead to skin cancer. Treating them, whether it be with cryotherapy, topical medications, or photodynamic therapy, help to prevent this transformation into skin cancer and can keep your skin healthier in the long run. If you have actinic keratoses and are interested in having these treated, make an appointment with Carter Dermatology. We would love to have the pleasure to take care of you. Thank you. Thanks again for watching. Give us a call to make an appointment. Check us out on Facebook or visit us on carterderm.com. Thank you again.